Hi, welcome to the Tuesday Facebook Live series. Today we are celebrating National Arthritis Month. May is National Arthritis Month, and we are going to talk about the 10 tips to take control of arthritis. My name is Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness. I am a physical therapist, an athletic trainer, and a fitness coach. And first of all, before we get started today, I want to give credit to the United States Bone and Joint Initiative. This is a collaboration of experts from the American Physical Therapy Association, from the American Pediatric Association, from the American Occupational Therapy Association, as well as a host of other wonderful expert organizations that are credible. And the reason I bring this up is because a lot of the information from today is just highlights of a full 60-minute presentation with experts in arthritis. And this is through the U.S. Bone and Joint Initiative. And I really encourage you to take some of these highlights that I am mentioning today and Google experts in arthritis, because a lot of information can be found. And the really cool thing about this group is that this is reputable, research-based information that you can trust. So I really encourage you, like I said, to go to the experts in arthritis or even look at the U.S. Bone and Joint Initiative. Just Google those and you will find a bunch of information that is very helpful if you are suffering with arthritis. When I mention that too, another great resource for you is the National Arthritis Foundation. So all of those, if you just Google that information, you will find a ton of information that's going to be helpful for you. Let's go ahead and just review a little bit about arthritis. There are three main types of arthritis. We have osteoarthritis, we have rheumatoid arthritis, and we have juvenile arthritis. Now, osteoarthritis is more of that wear and tear. It's related to injury. Rheumatoid arthritis is more of an inflammatory form of arthritis, and it's an autoimmune disease where your body kind of attacks itself a little bit, and it creates a lot of inflammation in the joints. So rheumatoid arthritis would be that one. And then juvenile arthritis is a combination of an autoimmune disease or dysfunction and an inflammatory condition. So those are the three main types, but we're really not going to be talking specifically about the three types. I just wanted to give you an overview of that. And there are tons of types of different arthritis, and the Arthritis Foundation does a really good job of giving those, going into more detail about all the types of arthritis that are possible. But those are the three big ones. And what we're going to do today is talk about 10 tips that you can do to take control of your arthritis. And the first one that we're going to talk about is often overlooked, but it's so important. And that is getting a good night's sleep. The average adult needs about 7 to 9 hours of sleep a night. And if your body is not resting, then it cannot rebuild its tissues or rebuild the structures that have been injured or stressed throughout the day. And people who chronically miss out on sleep are really doing their body injustice. But just in the general population, but if you have arthritis, getting enough rest and getting enough quality sleep is vital to you taking control of your arthritis. The second tip that you can do is eat a healthy, well-balanced diet. Now, there is quite a bit of research out there, and you can go to myfoodplate.org and look that up, and it gives you great resources on how to create and what are some dietary recommendations. But from an inflammatory standpoint, there's not a lot of diets out there that really talk about diets or foods and nutrition that decrease inflammation. Two exceptions of that show great promise. And these two diets, the Mediterranean diet and the DASH diet, are possibilities in helping to complement an anti-inflammatory routine. So the diet alone will not reduce inflammation, but these two diets may complement other things that you are doing to reduce inflammation. The first one is the Mediterranean diet, and this is going to incorporate vegetables, fruits, whole grains, fishes, such as omega-3s like salmon. It's also going to use healthy fats like olive oil within that diet. And then it's going to replace salt with herbs and spices. The second diet I talked about is the DASH diet. This is the dietary approaches to stop hypertension. Now, there's not a bunch of research out there about how this diet contributes to reducing inflammation in joints and arthritis, but there is significant progress and promise with reducing inflammation of the cardiovascular system. And the DASH diet consists of eating fruits and vegetables, whole grain, and then including low-fat dairy. So both of those diets are certainly worth a try when you're looking at a healthy diet regime and helping to complement the other things that you're doing to reduce inflammation and take control of your arthritis. The third tip today that we're going to talk about is staying active. Many times when people are in the middle of a flare-up with arthritis, the last thing they want to do is move because it hurts to move. However, staying active even in the midst of a flare-up is really important. And flexibility exercises or stretching exercises are key to keeping your joints and your muscles loose. The reason stretching is so important is because your muscles, when they tense up, they pull on the joints. And if they're pulling on their joints, they're putting extra forces or strain on those joints, and it can make them irritated. So keeping good flexibility is key to keeping your joints healthy as well. Another key to keeping your joints healthy is strengthening exercises. We don't want your joints to absorb all the force and the impact every time you take a step or every time you try and lift something. What we want your muscles to actually work. And when your muscles are strong, they do the work instead of the joints having to take on more pressure. So a good low impact type of resistance exercise program, I typically prescribe resistance band work and maybe some low weights or dumbbells with that. Nothing heavy though. We can do a lot of resistance work with body weight and resistance bands versus really loading up the joints, which can be an irritant for people with arthritis. And then the third part of that is cardiovascular exercise. So cardiovascular exercise is going to help your cardio and your respiratory system. It's going to help you build better stamina and build better endurance. And just it helps with the fluidity of your joints because your joints are moving. I do recommend for arthritis that you choose low impact exercises such as swimming, cycling, or walking. And even a low impact dance class might be helpful, and it's kind of fun and also give you a social option. So when we talk about staying active, we want to make sure that we're including flexibility exercises, strengthening through light resistance exercise work, and then cardiovascular exercise. So we get kind of a full package of staying active. Now, the fourth tip of taking control of your arthritis is seeking a qualified healthcare practitioner to learn strategies for self-managing your symptoms or your arthritis. This is key. You need to have a really good medical team. That's a primary care physician, a physical therapist, possibly a dietitian, possibly a massage therapist, just a good, strong medical team that can work with you. So you want to hire your medical team to work with you and give you the information you need to take control of your own arthritis. I'll also recommend, as a fifth tip, to utilize credible resources when you are seeking out information. And credible resources, like I said at the start of the class, would include the experts in arthritis through the United States Bone and Joint Initiative, the Arthritis Foundation, the American Physical Therapy Association, the American Occupational Therapy Association, the American Pediatric Association. These are all groups that are going to have reputable and quality information and resources that you can utilize. One of the best resources that I typically start people out with is the Arthritis Foundation. And they will help you find your local chapter so that you can have a support group, and so that you can also connect with physicians or people in a medical team that really focus and have specialized in treating people with arthritis. The sixth tip is seeking a physical therapist and following through with that physical therapy prescription or plan. The reason this is key is the physical therapist can really help you create an exercise program that works for you to prevent a flare-up and also to help you work through a flare-up. What I want to say here too is that many therapists know how to work with people post-surgically, like a total hip replacement or a total knee replacement. You want to make sure that you also find that physical therapist who knows how to work with someone preventatively and through that flare-up. I've seen many patients over the past 20 years, and they're really afraid to start physical therapy because they've had therapy before where maybe it was too aggressive, or maybe it put them into a flare-up, or maybe it made their flare-up worse. And working with physical therapists who specifically work with the arthritis patient population is key, because I know when I work with people with arthritis that if they're in the middle of a flare-up, we have to really back off. And maybe I do more hands-on treatment during that particular episode, or maybe I start to back off and kind of peel back the layers of the onion to see what was the root cause of the problem that created the flare-up in the first place. True story, I had a lady who loved to garden, and the springtime was just the worst time of year for her. She had a lot of triggers from the changes in weather. It would be cold, then it would be hot, then it would be cold, and then it would be hot. And then she was also trying to start her garden and clean up her yard. And that was always going to flare her up. So we worked extensively with actually replacing a lot of her garden tools so they had wide grip to the tools, and she didn't have to work so hard to squeeze some of her garden tools. And then we also worked with understanding how to use the right body mechanics to put her body in the best position when she's lifting mulch or pushing a wheelbarrow, or using some of the techniques like kneeling on a mat with volleyball knee pads, things like that, that gave her joints a little bit more support so that she wouldn't hurt during her really prime passionate activity of gardening. And she didn't have to give that up, but she did have to learn how to pace herself. And we worked together to create that situation for her. And she did a lot better by using the right tools, creating a strength program that allowed her to be able to do some of the heavier lifting. And then she also delegated some of the tasks to other people that were too much for her. So working with people like a physical therapist who is specialized in treating with the arthritic population is super important, so that we don't have flare-ups and that we prevent flare-ups from even occurring. Now, the seventh tip that you can do to take control of your arthritis is to manage your stress. And a lot of people don't realize that when they are emotionally stressed, when they're losing sleep because they have a major decision that they're trying to work through, these things are all stressors, and it doesn't even have to be a negative thing. It can be a positive thing, like you have a child who's graduating from high school, or there's a wedding coming up, or there's a new baby in the family. These are all positive things, but they are stressors. And so managing that stress and knowing how to pace you and prioritize your activities is an important step in taking control of your arthritis. And some little things that you can do is that have worked for other people. Some people enjoy reading. Some people enjoy taking a walk, a short walk, just to kind of clear their head. Some people enjoy aromatherapy, using pure essential oils. Some people may even enjoy a massage. And then another great benefit that we offer through my office is Aroma Touch. And Aroma Touch is actually a layering of essential oils applied topically. And that is to help boost the immune system and also to help reduce stress and kind of create restoration and create and promote balance within the body. So there's lots of options to help to manage that stress, and that would be the 7th tip. The 8th tip is understanding what type of arthritis you have. If we go back to those 3 main types, do you have osteoarthritis? Do you have juvenile arthritis? Do you have rheumatoid arthritis? Knowing which type you are will help you understand what may be your triggers and what then you can do to better understand how to prevent a flare-up or even decrease a flare-up when it is actually occurring. Number 9, I've kind of mentioned this before, but I did want to separate it out, is pacing yourself. So pacing yourself is the 9th tip to reducing or taking control of your arthritis, and it is so important to prioritize your day. If you have 5 loads of laundry to do, it might not be beneficial for you to climb up and down 2 to 3 flights of steps multiple times a day because of your arthritis. We might need to prioritize your day and prioritize your week so that you're spacing that type of activity out. The other thing is if you're running a lot of errands in one day and getting in and out of the car, having to grip, having to lift, having to move up and down steps or curbs and negotiate a parking lot, long walks from the parking lot to a store. Some of the stores are these mega box stores and they're just really big. So if you're planning on doing that one day, you may not be able to run a ton of errands the rest of the day if doing that type of activity flares up your symptoms. Again, prioritizing your day, prioritizing your week, and kind of being strategic about it so you can pace yourself. The 10th and final tip to taking control of your arthritis is accepting that you have arthritis. And once you accept that, then you can better understand it, you can manage it, and you can get the resources that you need to be able to take control of it. But it is important to accept the fact that you have osteoarthritis, or accept the fact that you have rheumatoid arthritis, or accept the fact that you have a child or you yourself have juvenile arthritis. Acknowledging that you might need help because of the arthritis condition you have is important too. You don't have to try and be a superman or a superwoman. And I really tell all my patients this, is that we do need to lean on family, we need to lean on friends when we're in the middle of a flare-up or when we're injured, because they can help us take some of the load off so that we can heal and so that we can kind of cope with what we're dealing with for that particular time. So those are the top 10 tips for taking control of your arthritis. I really encourage you, as I said earlier, to look up experts in arthritis through the Bone and Joint Initiative, the United States Bone and Joint Initiative, and look up information with the Arthritis Foundation, find your local chapter, get involved with the support group and with the resources there. It's very, very helpful to be around people who are going through similar things that you might be going through. I encourage you to Google that information. I also encourage you, if you know anyone who is suffering with arthritis to go ahead and share this video with them. If you are a physician or another healthcare practitioner, or if you're leading a group or a business and you tend to have people who have arthritis in your office or your business, I am happy to share more in-depth information through the actual experts in arthritis presentation with you. It is a full hour. We go into much more detail and specifics. So if you want me to host, if you want to host a class and a presentation, I would be happy to do that. Just reach out to me. If anybody has questions about anything I talked to or wants further detailed information on how they can get started with physical therapy, or just needs to start a conversation so they know what their first next step is, I'm happy to help with that as well. You can go to www.dewittptwellness.com. You can also reach me via email at Jeanette@dewittptwellness.com, and I'm happy to answer phone calls as well, so you can call me at 262-842-2220. Please share this information. It's very helpful for people to know that there are healthcare practitioners who know how to treat arthritis and to know where reliable resources are so that they can seek out credible information. Thank you very much, and I appreciate your time today.